Hello, and welcome back to the Mindful Healthcare Summit. My name is Jacob Solomon, and I'm delighted to be your host. In this session, we will continue exploring systemic transformation with Dr. Janice Nevin, President and CEO of Christiana Care, one of the largest health systems in the Mid-Atlantic. Dr. Nevin is pioneering value-based care and is nationally recognized for innovation in patient family-centered care and population health. In 2019, Dr. Nevin was selected as one of modern healthcare's top 25 women leaders, and in 2020, she was named to modern healthcare's 50 most influential clinical executives. Christiana Care is really helping to lead the way in innovating how healthcare systems support their providers and how they deliver value-based care to patients, so it is a real delight to be speaking with her today. Dr. Nevin, thank you so much for joining us.
Thank you. It's a pleasure to be with you today.
So, to begin, you've spoken nationally about your organization's values of love and excellence and how love can be transformational in healthcare. Can you share with us how you came to adopt these values at Christiana Care and what impact they've had?
We know that organizations that are faced with change, with uncertainty, are successful if the people in those organizations are not only resilient, but deeply connected to the core values of that organization and consistently demonstrate behaviors that reflect those core values. Shortly after I became the CEO, we were in the midst of an evolution at Christiana Care. We had been and remain a great hospital system, but we were committed to becoming a great health system, a system that truly impacts the health of everyone in all the communities that we serve. And we knew if we were going to do that, we had to become a fundamentally different organization. And so we developed our strategy, and then what we needed to do was really re-examine our core values and those supporting behaviors. And so I remember as we started the year and we were starting this work, I said to my leadership team, not only is it important that we do this work together, but fundamentally, I want to do this work in a way we've never done at our organization. I want to be able to walk around Christiana Care, go to every nook and cranny, talk to any one of our employees, and have them tell me how they contributed to this work. So it was about surfacing our values and behaviors, but it also gave us an opportunity to engage with all of our employees. And now we call our employees caregivers to some extent as a result of this work. And I will tell you, I was not surprised when We Serve Together emerged, because who doesn't love being on a great team? But we know that in order to be successful in healthcare, great teams have to work together. So We Serve Together was a manifestation of, at the end of the day, we're all on the same team. Excellence also not a surprise. Excellence is in our DNA as an organization. It's about being exceptional today and even better tomorrow. And we have a whole body of work that we call Making Tomorrow Happen, which is, again, our engagement work, really driving continuous improvement. But I will tell you that when the word love emerged, I sort of went, that's not expected, and it's really interesting. But the more I thought about love in healthcare, and why don't we talk more about love in healthcare? I fell in love with love, and it certainly generated a lot of conversation. And some people, frankly, started from a place where they weren't sure that we should talk about love in healthcare. But when you think about it, ultimately, to hear people say, I love my job, I love my work, that's what it's all about. For patients to say, thank you, you made me feel loved. That's what the experience is that we're trying to create. And there's actually some good evidence when you think about quality and the science of quality improvement. Some of the greats like Donna Bedian and Peter Pronovost and Don Berwick have talked about love being that ingredient, the glue that holds it all together. So it was truly an extraordinary experience just doing the work to surface those values. They have served us incredibly well.
What a beautiful patient outcome to hear that they felt loved. I mean, really, that's amazing.
Yes. Yeah, and I think that when we started and we thought about love, I mean, clearly it was about compassion, anticipating the needs of others. But as we've lived with these values and behaviors, what we have come to understand is when you lead with love, excellence is inevitable and equity is achievable. Because when you lead with love, you have to do some of the really hard things. You have to make hard decisions. You have to have some of those difficult conversations. You have to speak the truth with courage and empathy. You have to assume good intentions. You have to respect diversity. And, I think that in many ways, the learning that we've had as an organization around love as a value has been transformational. And, who knew when we did this work that we would be dealing with a pandemic? But it was our values that really, certainly in those early days, and I would say, continue to really support us as we go through some challenging times.
It seems like that work is tremendous groundwork for what's now arising or what has been arising over the past months.
Absolutely. And I think what was so interesting to me was sort of the speed at which our organization adopted the language around that value statement. I think to some extent because so many people had been involved in crafting it, so they had a part in it. But I will tell you, almost immediately, people started to use the phrase, that was a we serve together moment, or we accomplished that by leading with love, or this is all about being exceptional today and even better tomorrow. And so it very quickly became part of how we talked about our work, how we cared about each other. And, we did a lot of work in the following years. We continue to do that. We have what we call a behavior of the month. And every month, we revisit one of those behaviors that supports our values. And it gives us a chance to reflect and actually to continue to learn and further develop what those values and what those behaviors mean. So, for example, I start our weekly leadership meeting, with my executive team, with our executive team, doing a core values call out. And we reference the behavior statement of the month, and various members of the team share stories about experiences they have had in our organization, in our community, with each other that really demonstrate that we're living that value. And also, we sometimes share stories where we maybe have fallen short, because it represents an opportunity for us to learn. If this happened, what could we do differently the next time to make sure that we're true to our values?
There's so much I could ask you around what you were speaking to. One thing I just wanted to pull out really quick is how did you incorporate others or a large segment of the organization to kind of create or develop this work?
It truly was about engaging all of our caregivers. So we put out a call as we were contemplating how to do the work for ambassadors. We call them our values and behaviors ambassadors. And I asked for the request to include people who weren't sort of the usual folks that are tapped whenever there's this kind of opportunity. we asked that the various areas of the organization choose someone that they believed reflected those values and behaviors before we actually even talked about the word specifically. And what it meant that we got a group of people, for many of those folks, it was the first time they had engaged in this kind of leadership work. We asked for 150, we got 400. From the very beginning, there was a level of excitement, engagement about doing the work, and it was marvelous. I mean, it was so rewarding to see how people just really took the opportunity to participate. Those ambassadors were the conduit between frontline and leadership. So there was a constant process of going to our frontline folks, hearing what they had to say, and then bringing it back to leadership. And those ambassadors, we had many meetings with those ambassadors to help translate the information that they were finding, and then to craft the words and then take it back. We started by looking at our own values. What are our own personal values? And then we asked the organization, what are the words that describe ChristianaCare's values? So there was a real process of going back and forth, taking it all in, that when we emerged the phrase, it really was from the entire organization. You know, I had fully expected that we would end up with 4 or 5 words, which you typically see. You know, you walk around an organization, those few words are on a poster somewhere hanging on a wall. That was my expectation when we started. I thought we would get a series of words. What we created because of the incredible people at ChristianaCare was so powerful and has been so impactful. Talk about exceeding expectations. It really did that.
Well, speaking of love, we'd love to hear some more about the Center for WorkLife WellBeing. What was the inspiration behind creating the center, and what needs were you hoping to address with it? What are some key services and initiatives that it offers, and how have they impacted staff well-being and the culture in your hospitals?
A lot there to unpack. We started talking about the whole issue of the caregiver experience as early as 2013. It really was as the whole sort of topic of physician and provider burnout was surfacing. We know our caregivers are our most important resource. We can't be successful without our extraordinary people. And healthcare is challenging. And we know that our caregivers are at times experiencing some of the adverse events that occur in our hospitals, and they need support. We also know that our caregivers, in order to be able to provide the best care, the safest care for patients, and to keep each other safe, need to feel well, need to feel supported. So many reasons, so many important reasons for us to really engage in thinking about how do we create a culture of well-being for our caregivers that would support all the work that we're doing, caring for patients, caring for our community. And Dr. Heather Farley, an emergency department physician, really has provided the leadership for this. She was inspired by some of her own experiences, and she had a vision about what we could do at ChristianaCare. And it was very easy for me to buy into that vision because it just made sense. You know, yes, we've got to care for our people. If we can care for our people, then we will be able to achieve what we want for our communities, and that is health. We started with sort of with some ideas, and frankly, over the last 5 or 6 years, we have really grown our Center for Work-Life Wellbeing. There are many aspects of work that they do, so I'll just hit some of the highlights if that would be helpful. One of the important areas of work that they have developed is peer counselors. So we've got more than 50 peer counselors who, if there is an event in the hospital, they are trained to go and engage with the caregivers. It grew out of a program that we called Caring for Our Caregivers. So I hear stories, for example, if a team member dies unexpectedly, you can imagine the profound impact that it has on the people on that team. Having someone from our peer group, our Caring for the Caregivers group, go to that team, it provides comfort. It starts to help with healing. And so that's a great example of how not only have we reached out to care for our caregivers, but we've engaged our caregivers in that work, and it's very meaningful. We have what we call oasis rooms. We've got more than 10 of them now in various places in the hospital. These are rooms that are all about healing, calm. When you can imagine, in the middle of a really busy intensive care unit shift, a nurse has some experiences that can be really stressful. This gives her or him the opportunity to go and sit, to meditate, to lie in a recliner, to find peace, and to sort of renew that inner purpose. It gives them the strength then to be able to go back. And the stories that I hear from people who have used these rooms are really just, they really get to my heart. For example, one story about a nurse who was caring for a patient in the intensive care unit who was really sick, but was also really challenging her and calling her names and spitting at her. And, it made her feel angry and uncomfortable. She had the opportunity, with the support of her team, to go and spend time in the oasis room, gather herself, get back together, and then, come back to her work with the focus that is needed in that kind of setting. You can imagine if she wasn't able to do that, she would be carrying that home with her, or it might be something that gets expressed the next patient that she has to care for. We know these rooms actually reduce turnover in units. We know they increase engagement. So they're not only rooms that are important from a personal sense, but it's good business sense. When you have people and you're investing in people, and they have the opportunity to decompress, you're providing better care. You're hitting those quality metrics. You're hitting those business metrics. So it's the right thing to do for many, many reasons.
I think I actually saw some of those, the peer counseling and the Oasis rooms highlighted in a New York Times article. And I just want to say my felt experience of seeing those pictures were truly worth 1,000 words. I was blown away, and it brought me to tears, actually. I was really amazing.
Well, I will admit it brought me to tears too. And I know the work, but I think, seeing it presented in that way, you got the chance to sort of really feel the anguish, but also see what's possible and see the hope. And having the Center for WellBeing in place as for work-life well-being in place as we hit COVID, oh my goodness, was one of those things. Like, I am so glad that we had the foresight to make this investment so many years ago, because as soon as the pandemic hit our organization, we knew from the get-go that our caregivers were going to be our priority. And we invested in childcare, we invested in hotel rooms, we invested in disposable scrubs, as well as all of the PPE and the training and the testing, everything that we needed to support our caregivers in their work. But the Center for Work-Life Wellbeing just really sort of amped up everything they were doing in that moment. And one of the things that they do, and they did 24/7, and they continue to do, is essentially walk around the units with a little cart. And on that cart, there are comfort items like lip balm and snacks and hand sanitizer. But what really happens at those carts is the caregivers get the chance to talk to one of the members of the center's team, maybe a psychologist or a physician or a peer counselor. And those carts became the place where meaningful conversation happened, where caregivers were able to feel really safe saying, I'm worried about this, I'm anxious about this, I'm worried about my family. And it also became a place where if we saw, there was a real concern, we could connect that caregiver to a therapist, for example, so that they could get their needs met. It was invaluable for all of us. They in the early days, they even came to one of our leadership teams with the cart to make sure that we as leaders were cared for and also feeling okay. Truly inspirational. And as you can imagine, the COVID experience has been really hard on our caregivers. Although I will say, amazing people. I mean, just the way folks sort of stepped up, rolled up their sleeves, sort of came at this work with, it's healthcare, it's what we do. And at Christiana Care, we serve together with excellence and love. So we're going to bring it to this pandemic. COVID-19 needs to be put on notice because we're here. But the Center for Work-Life Wellbeing, absolutely critical in making sure our caregivers got cared for. Just another story, again, the intensive care units, really were hot spots in our organization. And Dr. Mike Benninghoff is the leader for Christiana Care. He runs our ICUs, and he was asked by a news reporter, so how's the morale in your ICUs? And he said, morale is great. And he talked to the reporter about the Center for Work-Life Wellbeing and said, this is the reason that our morale is high. These folks have sustained us through this. And he clearly was able to share how important paying attention to caregiver well-being is to managing through a crisis.
Wonderful. So obviously we are living through an unprecedented time, and supporting the mental health of our providers is a major concern. Actually, a recent study in JAMA found that much of the distress of healthcare providers, quote, could be headed off if hospital leadership created a proactive, supportive culture that included ways for workers to express concerns and feel heard, end quote. I feel like you all are already doing this. I'd love to hear what you see as the keys for healthcare leaders to really support their staff during this time, and how has Christiana Care been supporting its staff through the pandemic? Yeah,
I couldn't agree more. It's about the culture, and there's so much that can be done. So some of the work that we have done to support our caregivers has been in creating a minimum wage of $15 for anyone who works in our organization. It's paid parental leave for new parents. It is, it's food banks. So many of the people who live in the communities that we serve also work at Christiana Care. And we want to find ways to support people financially and holistically when it comes to their health. And we have done that. We continue to find ways to care for our caregivers in a way that really honors their service to us. I would say, when I think about the pandemic, what was really important, and the top three: communication, 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 and particularly transparent communication. If you don't share what is happening, it gives people the opportunity to write their own story. And, one of the challenges, particularly in those early months, although I would say, still to some extent a challenge, is, where's the source of truth? What's really happening here? And we made a commitment, and I think did some really good learning that we're pulling through and will continue to do, about the importance of transparency. We agreed that we would share, we would be open about what we were seeing, our plans, how we were responding, and I think that really gave people a sense of security. If I know what the problem is, I can do what's needed to solve it. And we're going to continue to do that. We used every modality that we could figure out how to use in the pandemic also. I mean, videos, recorded conversations, obviously emails and posted notices, all of that. The other thing that we did, which I'm just so proud of our organization, we realized that our messages needed to be delivered not only in English, but in Spanish and in other languages. And we started to dub my videos. I would do a video and in English, because that's the language I speak, and then it would appear in Spanish as well. And we got to the point where we could release that information in English and Spanish at the same time. It sounds really basic, I know, but it's something that you don't necessarily see. And we learned so much about how to connect to caregivers around communication. And I think, again, it was really, making those investments, as I mentioned. Our caregivers were so worried about childcare. We supported childcare. Many of them, particularly, if they were concerned that they had been exposed, didn't want to go home. We had blocks of hotel rooms that we paid for. I started to hear stories about caregivers who would get home, strip naked in the garage, run through the house to the shower. I said, that doesn't sound good. We can do disposable scrubs and help support people so that they don't have to have that experience. And again, it was really about, and I'm so proud of our board as well. We said we're going to do whatever it takes to take care of our people, because it's the right thing to do, and we know if we do that, they will provide safe care for our community, for our patients, and they'll take care of each other. And that's what we did, and we're continuing to do that.
You were trained as a family medicine physician, and I understand that concept of the biopsychosocial model of health is an important part of your vision for healthcare. What is that, and how does it relate to mindfulness?
Yeah, absolutely. So the concept of the biopsychosocial model was written about in the mid-1970s by a psychiatrist by the name of George Engel. And the idea is that in order to achieve health, you have to take a holistic view. It's not enough to manage the medical needs of a person. You also have to manage the behavioral health, the psychological needs, and you have to provide care for the social needs. And if you integrate the medical, the psychological, and the social, then you give that individual the opportunity to achieve health. It's what attracted me to family medicine. I actually wrote my medical school admission essay on the biopsychosocial model of care. And it's what we do as family physicians. It's why I loved and still love family medicine. The opportunity that we have now is to create a 21st century version of that model, and to support that model by employing some of the technology that's available to us to provide care differently and to serve to integrate differently. For example, typically a patient makes an appointment to go visit a healthcare provider. You have to pick up the phone, maybe you can go online, but you're going to leave your house, find a place to park, walk in the door. That's how we have typically done healthcare. Imagine something completely different. Imagine what we did through our COVID-19 monitoring program, applying to most of your healthcare needs. Our COVID-19 monitoring program took care of people who were, and still does, people who are waiting for test results, have COVID and are at home, have been discharged from the hospital, and we made it available to our caregivers. And you answer a few questions and it creates a risk score for you. And as a result of that risk score, you are red or green every day. If your symptoms change, and we know we're doing secure texting with you every day, you have an opportunity to get a reach out, to respond, or to ask a question. And if something changes in your profile, it alerts one of our virtual care providers, and we can do a virtual visit. And we can, in that moment, change the trajectory of your care, because we can intervene at that moment and do what's needed. We can send more services to your home, or if necessary, we can direct you to the right source of in-person care, and then we can continue to monitor you. Now think about if that's how healthcare worked. If somebody knew all about you, they knew your medical needs, they knew your psychological needs, and they knew your social care needs. And that was all in one spot. And they used the data that you were generating, either at home or through devices that were at home, or devices that you're wearing, or secure texting. And again, in that moment, someone could reach out and say, "Are you okay? Do you need help?" And you could get help when it's convenient for you, in a way that supports your healthcare needs. Data-driven, technology-enabled, but fundamentally about love and excellence. And I think that is the future of the 21st century biopsychosocial model of care. One of the aspects of COVID was that it surfaced many things, but we knew we had shortages of mental health resources in this country before COVID. It has demonstrated that we continue to have a serious need for those services. We've got to do something about it. And there are ways that technology can support people who have depression, who have anxiety. And it's really important that we start to think about addressing that in a very different way. If you're getting your primary care needs, we also need to understand what are your behavioral health needs. If we know that, but you still don't have access to food, or you don't have access to housing, or you don't have access to transportation, we're not going to be able to help you achieve health. And so integrating all of those, absolutely critical to making sure that you as a person achieve the health outcomes that allow you to lead the quality of life that's important to you, and to do it in a way that respects costs and create affordability. Mindfulness is very much a part of that. It's a great way to help people with their behavioral health needs. To integrate the practice of mindfulness allows people to achieve health.
Health equity is a huge topic right now in light of all that is happening in the world. And it's a topic that does require heart and love and excellence. I know that Christiana Care has been actively engaged in the discussion about race that has been taking place across the nation in recent months, including making a commitment to anti-racism. Can you share your perspective on that?
We can't achieve health unless we pay attention to equity. We've been thinking about and working towards eliminating health disparities for many years. We have an Office of Health Equity and a Chief Health Equity Officer who really drives those efforts. It's understanding, where those disparities exist, and then understanding what's needed to reduce the gap. It's also meant that we've learned how to relate to the communities that we serve in different ways, and we've really sort of shifted our thinking from community engagement and benefit to community partnership and investment. And that has been very rewarding and was one of those other aspects of COVID-19 that, having those deep partnerships with community-based organizations allowed us to partner around COVID issues for those communities. So it's been very much part of who we are as an organization. Embedding equity into everything that we do is how we think about it. And we know that we won't achieve our organizational goals, our communities won't achieve health unless we pay attention to it. Race is, and racism is, a public health issue, period. There's just, no question that unless we pay attention to issues of race, we will not be able to achieve equity when it comes to health. As an organization, we've been committed to doing this work. As a person, I am committed to doing this work as the leader of this organization. When we experienced the deaths, the murder of George Floyd, Breonna Taylor, Ahmaud Arbery, we knew that we needed to take action. And one of the most compelling things that we did, at least from my perspective, it was really meaningful, certainly to me, and I think to many others. We participated in the White Coats for Black Lives event, and we all took a knee, socially distanced, wearing masks for 8 minutes and 46 seconds. We had people at our hospitals, people in our practices, people at home. Our board chair took a knee in her home. It was really, really moving and important because it was a catalyst to really start to change and deepen the conversation about race inside our organization. We have been in a series of courageous conversations, having both outside folks come in and help us better understand the impact of racism, but also inside our organization. And I've had the privilege of hearing directly from our caregivers about their experience in our organization. And that really compelled us to produce the anti-racism statement. It is a commitment, and it's a commitment to honor those words by doing differently.
Thank you for your commitment to that work.
Absolutely. It is, we will not be successful unless we pay attention to race. And as I said, as the leader of Christiana Care, I am deeply personally committed. What do I need to learn? How can I be a better leader? How can I aspire to be an ally? I have to commit to doing my own work as the leader of this organization as we do our work together.
And just to affirm the work you're doing, I saw that video of you all taking a knee, and it rippled out. It had an effect on me, and I'm sure all those who watched it.
Thank you.
What advice would you offer to young, value-driven leaders entering healthcare leadership today? What advice would you offer to young women leaders in healthcare today?
I would want to start by expressing my gratitude for choosing healthcare. When we think about healthcare, we think about doctors and nurses and therapists and the group of people that are absolutely critical in caring for patients. There are a lot of opportunities to have an impact in healthcare if you're an engineer, if you are a software developer, if you are someone who loves technology, for example. So one of the things I think is really important to know is there are lots of opportunities. If you want to be in healthcare, you don't have to be in a clinical area. It takes a village to run healthcare organizations, and there's something very meaningful about being a non-clinician and having that impact. It's why we call everyone who works here a caregiver, because you're either directly caring for a patient or you're supporting somebody who is. Lots of opportunities in healthcare. It's a great field. I would encourage people to take full advantage of the opportunity. If you're new, do well at what you're doing. Keep your mind open to listen, to learn, to understand what other opportunities exist. And as those opportunities come along, don't be afraid to put your hand up and say, I'm in, pick me. I think it's especially important for young women. There are so many areas in which young women can grow and develop. You've got to be able to see those opportunities, recognize it as an opportunity, take that risk, and find some new experience, become part of a new team, allow yourself to grow.
Wonderful advice. So you mentioned gratitude. There's actually important research that's been done by the Greater Good Science Center at UC Berkeley, which has quantitatively shown the power of gratitude to positively impact healthcare provider resilience. What does gratitude mean to you in the healthcare context, and how is that expressed at ChristianaCare?
Gratitude is one of those other practices that I try to do on a regular basis. In fact, when I get home in the evening, my husband, who's also in healthcare, we try to make it a point of starting with what was something good that happened in your day-to-day that you're grateful for before we launch into, can you believe what happened today? And we have found that if we can start from that place, it's really good for our relationship, but it does help frame all of those things that have been particularly challenging. So it's something that I try to do on a regular basis. Simple words, thank you, but so meaningful. And we work hard as an organization to appreciate each other. In those moments, to say thank you can go a long way. And I've heard that particularly through the COVID pandemic, is just the fact that someone said thank you was so meaningful for that person. But we also do some programming about being able to express gratitude. One of the programs that we do is the thank you program. And I have watched and seen some of these, and I will tell you, we talked about sort of shedding a few tears. This is another one of those experiences that will do that. This program reconnects patients who have really been critically ill, who've had a challenging medical experience, with the team that took care of them. So, for example, a young woman who was passing out frequently at home, came to the emergency department, had a massive pulmonary embolism, almost died, several times, required lots of surgeries and then rehab. So serious illness, a prolonged hospital stay, and she became well, and she came back to say thank you to the people who had provided care for her, with her husband, with her child. That renews our caregivers. It reminds us of why we have chosen healthcare, its meaning, its purpose. And those moments, they are just so heartfelt and so incredible and so filled with gratitude. One of the programs that we are doing as a result of COVID is called Code Blossom. and a patient who's been with us, who's been seriously ill from COVID, gets to celebrate their discharge if they choose. And we call a code blossom in the hospital, and caregivers from all over come and line the hallways and cheer as that patient is discharged from the hospital. And one of the most celebratory events that we had, one of the best code blossoms, was a patient, a woman who had worked for Christiana for many years. She had since retired. She was critically ill from COVID. We saved her life. She spent time on rehab, so she was with us for an extended period of time. And to have that celebration of her discharge, one of our own who'd been cared for by our own, it was incredibly moving. It's really important that we do that. We have to say thank you. It is one of the most important ways that we connect to our purpose. Thank you for asking that question.
Sure, thank you. Any final thoughts or inspirational words for our audience? Anything you'd like to share?
I really appreciate the opportunity to have this conversation. Thank you for letting me share some of our experience here at Christiana Care. I believe I am an optimist, and I look to the future, and I really do believe that we can work together to implement that biopsychosocial model infused with mindfulness and really make a difference in achieving health. I know that when we serve together, when we lead with love, excellence is inevitable and equity is achievable. That's what we can do together.
Thank you so much, Dr. Nevin. You are truly an inspiration and an innovator in your field, and I hope many people get to see this video. Thank you.
Thank you so much.